后，还出现了个别新增本土的确诊案例，无症状感染者数量也有所增加。疫情防控任务依然艰巨繁重，
transportation
尤其是
department
境外疫情
would
输入压力
also be
持续
strengthen
增大。
the coordination
所以我们
of
的防疫
shuttle
要保
bus
持
leaving
信息的
Wuhan
疏导，
and making sure the
做到
smooth
两个不降
operation
低，
of
警
transportational system.
惕性不降低，
3.
防
We
控
will
要
keep
求
a close eye on the changes of
落实
prevention
落
control
细
of the
两
epidemic
防
so as to make
即
sure that
外
the
防输
measures
入
are
内
implemented.
防反弹。
Right now, we are seeing a lot
此
of
外
positive
具体呢
signals,
有以下5项措施
but
来
there
进一
are
步保障：
also
一是加
some
强
single
源头管
confirmed
控，
cases
各市州防
after
控指挥
March
部
the
要落
8th.
实属地管理
And
责
we
任，
are seeing an increasing
负责
number of
统筹全面
asymptomatic
恢复
patients.
属地交
That's why
通
we are
运
also
输秩序
facing
完
a
善
more complex
地段
situation,
各市州县
considering
区
that we are
防控指
facing
挥部
mounting
要
pressure
加强
from
宣传引
abroad.
导，
So
倡导
we have to make sure that we will not relax and will not lower the standard of prevention and
强化
control.
常态化防控措
And
施，
we need to prevent
严格
imported
和规范
cases
社区
from coming
输
in
入管
and
控，
the rebound of
落实
local
源
cases.
头
And
管
here are
控
the
责任，
measures.
对进出人员
First,
做到4B，
we need to keep
It is
a close
身份
monitoring
疑问
of the origins.
信息闭路，
The local cadres are held accountable when we are slowly
对
restoring
境外
the
入俄人员
previous
严格按照
transportation
湖
orders.
北入境人
The
员
districts
疫情
and
防控工
counties
作
and their
指
command
导方
center
案
must
实施，
strengthen education
坚决落实4个一律的要求，
and
也
would
就是
promote
一律
the
进行核
would
酸检测，
promote the
4类人员一律
proposal
按照
that
防控规定
do not
就
go
地
out or do
分
not
类
leave
处置
Wuhan if
其
not
他人员
absolutely
集中隔
necessary.
离14
And
天，
we have
入境
to
来俄人员
establish this
一律
accountability
纳入
system.
当地社区的防控体系。
We need to make sure that the
三是
information, the
强化部门
identity,
监
and the
管
temperature
二是强化
and
部门监管，
of the
交通运输部
people
门要
are
确保
mandatory,
运输
and all
通道的
people
畅通，
must
确
wear
保运力
face
储备，
masks.
要督促营运
For
企
all
业
those
做
coming
好
in,
运输过程防疫措施的落实。
We also have
卫健
specific
部门要
requirements.
做好疫情防控、
First
健康通
is
行指导
to conduct
和
nucleic
监
acid
督落实。
test.
公安部门
For
要
4
维
types
护
of,
好道
of
路
people,
交通
they
秩
need
序，
to
确
be
保市级、省级的
quarantined
通道
and
畅通。人事部
been
门
sent to
要做好复工复产人员、
necessary
不需对接
locations
服务。
and facilities
教
and
育部
be
门要
incorporated
做
to the
好
local
学生复学
prevention
后
control
乘
system.
坐交通运输工具
We also
疫情
need
防
to
控
strengthen
管工
the
作。
coordination
应急管理部
between
门
the
要做好
transportational
应急事件
department
预案和处置
and
的
other
相关
department
工作。
and the transportation department
三
also
是
need to
压实
urge
责任主
the
体，
carriers
交通运输
to
承
be
运
held
企业
accountable,
要督促
and the
做
health
好乘
department
客
need to
凭
make
健康
sure
码
that
绿码
the
乘车，
health
测温
policies be
及发热
implemented.
乘客
The
移
public
交
security
乘客
department
佩戴
would
口罩
also have
等
to
工作，
make sure the
督促乘客
smooth
不
channels
在车厢
in
内
and out of the
走动，
city.
实
The
行分散
service
售票、
sectors
格位售票、
and
和
Department
错位
of
就座、
Education
分
would
散
also
行
have
动、
to make sure that
科学
when
控制
the
好
students are going back
客
to
流量。
school, their
客运
commute
站
can
场和
be
交通工
properly
具
managed.
预留疫情防控
We
的
also need to
必要空
properly
间
do with
和
emergencies.
席，用于配
Three.
合卫健等部门实施隔离措施，
The
加强客运站场
transportation service providers
通风
must
消毒，
carry out strict
提供
measures.
良
The
好的
passengers
交
can
通
only have
出行环
access
境。
to the
四
vehicles
是强
with
化安全
their
生产，
health code,
交通运
and
输
they
企
have
业
to wear
要落
masks
实
all the
交通
time
运输安全生产
and
主体责
reduce
任，制定完善应急保障预案，加
unnecessary
强公共交通本质安全管理，
overgathering inside the
落实
vehicle
运输全过程的
so as
监
to
控、信息
avoid
闭环
overloading.
的处置，严格执
Spaces
行
must
交通
be
运输安
remained
全生产各项操作规
and
程，坚决遏制
so as to
重大
facilitate
事故的发
quarantine
生。
measures.
那么现在
We also need to strengthen ventilation, disinfection on the transportational means so as to provide a better environment. 5. The enterprises must carry their responsibilities and strengthen security management on the vehicles and monitor the process in a proactive manner and process this information in a timely manner. And we have to exercise SOPs and avoid major accidents from happening. Currently, we have already stopped the lockdown, lifted lockdown of the city, but we have to be more specific and more cautious when taking the measures, and we shouldn't relax and stick to the end till we have finally won this battle to defend Hubei and Wuhan. Now the floor is open to questions. Please identify yourself. Thank you. With Economic Daily, my question is, after the lifting of the lockdown, people still have concern as to the transportation. So how do we strengthen the joint prevention and control mechanisms under such a circumstance? I have already touched upon some part of that question in my previous report. I will make some additional remarks. This morning, we officially lifted the lockdown of the city. This is a decision made after careful evaluation of the risk level in the city. And this proposal was first submitted to the central government before it was finally implemented. But we have realized, and we are very clear that we are not over this war yet, and we have to stay cool-headed and continue with our work. To be more specific, here are some of the measures. First, we will further strengthen the source and management of the source. The city of Wuhan have done a lot of preparation for the lifting of the transportation ban, and we have issued a notice on continuing with this long-term management of prevention and control. According to yesterday's press conference, we also mentioned that there are 4 requirements, and we have to know the temperature and identity, as well as made it mandatory to wear masks. And we also ask that the residents avoid going out unless absolutely necessary, so as to reduce the gathering of crowd, so as to cut the source of infection. Second, Green Code is your only access to all public transport. This health code is the health license that is issued by the government, and we will continue with our work to review this Green Code, which is very strict, I believe. Those without the green codes will find it difficult to travel even inside the city and on public transport, let alone going out of the city. If you are red code or yellow code, you are not permitted to go out. You have to be granted the green code before going out. We also need to strengthen this coordination between us and other provinces. So this is a national scheme in terms of prevention and control. 3, we need to establish this inter-department cooperation mechanisms as well as inter-provinces coordination mechanism in order to guard against any risks that might be brought about by the lifting of the ban. With China Daily, my question is, after the lifting of the lockdown, there might be a lot of an increasing mobility of personnel. So what did the Transportational Department did to strengthen administration in this regard? Thank you again for your interest in transportation. After 76 days of lockdown of the city, we have it has played an important role to contribute to the final victory against such a virus. It is a decision made according to the central government's instruction of preventing importing cases as well as prevent the further spreading inside the country. After the lifting of the ban, there is a possibility that that we might see some increases of crowd in many public places. After careful evaluation, however, the Transportation Department has made careful arrangement accordingly. First, we have urged the railway, civil airlines, and waterways as well as post department to make measures to realize the modulation of transportational resources so as to make sure that the capacity is enough to meet the demand. The railway and civil aviation and road transport should share the information together so as to realize a smooth connection through all of these channels. The railway department must make sure that the trains going in, going out, and going through Wuhan are smoothly operated without the possibility of letting people stranded in the train station. And 3, besides freight transport, the Civil Aviation Agency also need to make sure that we have enough capacity. And 4th, in terms of road transport, the Transportation Department have to make sure that the shuttle buses out of Wuhan can serve as a major substitute to the transportation capacity. Right now, the freeways, the expressways are still free of tolls, but we are still facing a lot of challenges ahead of us. 5, in terms of city transport, we have to make sure that the last mile and the first mile of the city public transport are efficiently guaranteed. And we also need to provide commute services to the workers. After the lifting of the ban, can the residents drive private vehicles outside the city. As is known to all, this morning, Wuhan and the surrounding regions have lifted the lockdown of the city, and all the roadblocks that are used for prevention control of the epidemic have been removed, and normal orders have been restored. So we ask that no roadblock or checkpoints on the pathways and on highways are permitted, and it's not permitted to ask anyone who wants to drive out of Wuhan to show any kinds of licenses. And the Ministry of Human Resources also issued notice that the Green Health Code is the health lessons that grant the residents the passes to access the public transport. We have to avoid any circumstances all problems related and hinders the people or transportational vehicles to be floating, to be driving in and out of the city. We have established this coordination mechanism and strengthen our connections between different departments so as to make sure that the vehicles and personnel leaving the city's interests are protected. We also have issued policies. If there are vehicles that did not go through annual checks due to the epidemic, we will not give them a fine. Instead, we'll give them a grace period to do the annual check of your vehicles, and you can also register online to complete the process. The lockdown lasted for more than 70 days, and we're hoping that the city can reboot as soon as possible. So why do we restore the transportation order step by step instead of once for all? The reboot of the city transportation comes first. After the ban was lifted, the city government and the transportation department's biggest responsibility is to make measures to guarantee the operation of the transportation and address the problems of people going in and going out, as well as the commute of the local residents. After careful research of the commanding center, we have made scientific targeted prevention and control measures to ensure the stability and smooth operation. And we made the decision to restore transportation order in a gradual manner. We need to control the rhythms, not too fast, not too slow. Orderly means that we need to make sure the safety. And third keyword is modest. The capacity has to meet demand. So the first consideration, currently, despite the positive trend in terms of epidemic control, we are still facing daunting tasks to guard against imported cases and prevent the rebound of local cases. So we open up our gate doesn't mean that we will we will completely relax.
这两大人群。
We have to stay highly alert and remain this high demand, high requirement in terms of prevention and control. In terms of demand and provision, our main task here is to ensure that the city can operate in a smooth, safe manner and orderly manner. It has to be sufficient to support the development of the city. So the key priority for us is to protect the interest of returnees and the migrant workers as well as local workers. We have restored 316 bus lines and 6 subway lines. As of yesterday, the total number of people traveling by bus amounts to 64,000, accounting for about 2% on a daily basis. And number of people taking metros are only 36,000 people per person time, which accounts for about 6% of the daily normals. And right now it's proven to be sufficient enough to sustain the operation of the city. After the lifting of the lockdown, the returnees and migrant workers would also begin to travel. So we will be gradually restoring another 30 bus lines as well as Metro Line 8 and ferries and trams. We are gradually going to restore 70% of the bus lines and 78% of the metro lines. We will also be optimize the arrangement so as to facilitate the transfer between different transportational vehicles. We also plan to restore this passenger shuttle bus inside the provinces. We will be making timely adjustment to our plan according to the latest update of prevention and control. My question is, goes to Mr. Xu Bing. What are the preparational work done by the Transportation Department to ensure the safety and security for the residents to travel on public vehicles, public transportation vehicles? It is important for us to continue our good work in terms of prevention and control, especially when we have resumed public transport. And here are some of the specific measures we've taken. First, 3,000 staff members are assigned to work in bus stations, airports, subway stations, and ferry stations and docks to conduct disinfection in more than 3,500 locations. We also ask that for each round of the buses, they have to strengthen ventilation and disinfection on board. Second, we also conduct this maintenance of the public vehicles so as to make sure the smooth and safe operation of the transportation vehicles. 3, you have to use your health code to have access to the transportation services. 4, we assigned special workers on board to urge the passengers to wear masks, use their health codes, take their temperatures, and to maintain a smooth operation manner. 5, we need to control the density, the people's concentration on board, so as to avoid overcrowding.
这个问题，请徐明先生回答。
In the stations as well as on the vehicles, it is of paramount importance for us to control the people flow in these stations. Last question. With Hubei TV, the restoration of public transport would increase the risk of cross-infection, and what are the emergency mechanisms if a fever patient is found on one of the public vehicles? In order to handle the possible health risk during the travels on public transport, we have established this emergency mechanism between different regions and departments. In railway stations, bus stations, as well as airports, we have made different measures respectively. In the train stations and airport, we have assigned special personnel to work on site in order to manage the transportation, the quarantine of fever patients. For the fever patients on buses and metro, we also have this alert system and report system, and the patient would be transferred to local medical facilities so as to control the risk to the minimum.